afternoon. Welcome to Health Dialogue by BDMS. This is our 25th episode. And I'm here today. I'm Ying as an MC, really as an MC always. And we are here today with Dr. Chachai Jaransi. He is the Director of Wellness Center, Assistant Hospital Director. Okay. And the nurse there, she is our in charge nurse and register nurse who worked 20 years in the hospital Phuket. Kun Sirik Suda Koitanaku. Or we will call her Kun Yui and Dr. Chachai. So welcome to our program today. And of course, we are working together in the hospital. And now, well, I think maybe it's not right. Maybe it's right. Maybe you two have confirmed to me that I think now people focus on their health and we want to stay healthy because we worry so much about what happened, what's going on everywhere, not just on the island. So I would like to check and to ask about how can we live our life without like panic or nervous on this island? Can you maybe help? Mm-hmm.
You are healthy.
Yeah. I think I am healthy, but it doesn't look that way. But yeah, some say, you're okay, you're healthy. But sometimes I feel overall, not okay today, day by day, actually. Mm-hmm.
But, okay. I think that you still okay right now.
I think I'm okay.
With
Yeah, doctor, that is a fact of my life. I'm 50 years old plus and 100 kilogram plus.
Okay.
But I'm healthy. I think so because every morning I can wake up and run to service my son, come to work. What else do I need?
Yeah. You need to check. First, you need to check it out. Check it again. Check it.
Not only feel it, right?
Yes.
Okay.
You feel it. You feel it. But we have the machine, we have the lab test, and how do we check it and work out your body feel it?
Okay. So to say I'm healthy with evidence, with the result from laboratory from the check. Okay. Then I can confirm that I'm healthy.
Yes, of course. Yes.
So how important is it? Why I have to do the checkup?
The regular checkup program relying on this physician. Help us to see deep inside your body and your blood. We can find out that the potential issue or became the serious or disease problem. And then especially if we can do it, it's the best way for the best time quickly and prevent the first complication.
You may detect by check at the hospital with the machine, with the blood test kind of. I thought that maybe I'm living my life 2 or 3 years and after that I feel achy somewhere, I feel not okay somewhere, then I detect myself first and I come to the hospital. I thought it should be like 3 or 5 years and then I come to the hospital.
It's different. It's different because on there's no sickness. Sickness person. Just the healthy or healthy feeling person. The sick people get it first.
Okay.
But the others,
Wellness, healthy.
But need to check out and work out about their health status. Okay. And especially nowadays, please change your mindset. And not compare that check-up program like mileage check-up for the car, for the bike. Okay, you can
So
compare.
every 10 kilometers, 10,000 kilometers,
Oh,
I have to
yes.
bring my car.
Yes,
yeah,
Yes.
back to be checked, something like
Yes,
that.
the showroom or the service center of your car brand, okay, will
Ah.
call you
Uh-huh.
out to check up your car or your bike.
Ah.
And no, it's different. It's different with our hair and our health status
Mm-hmm.
because of that the car and the bike. We have many parts to replace if there's a
We
problem.
can buy spare part.
Yes, the spare part. Yes, but our health or our
Uh-huh.
body, there's only 1 dozen of the parts that we can replace.
Mm.
Uh,
Maybe they don't have my size too.
yes, oh yes.
Some
Oh, yes.
some spare parts may not fit me.
Okay. And yes, then nowadays checkup program, okay,
Uh-huh.
not. I don't want to use the checkup program to find out the abnormal value or the
Ah.
abnormal in your body.
Ah.
Change your mind, okay, please, because of nowadays we use this machine to
Mhm.
tell us that your readiness to live longer, the longevity
Ah.
of your age and healthy status.
Oh, that mean even I feel okay, I should come regularly to do the checkup
Mhm.
to confirm that I'm still healthy, like I'm thinking,
Yes,
and also I'm fit enough to enjoy my everyday life and enjoy my work, for
yes.
example.
Being
And
nowadays and
uh,
go move
uh-huh.
forward okay, in the future,
Mhm.
we will have the longer age year than ever in our human history. Don't
Oh.
worry, okay? You may stay in a longer at 50 years old. You need to be okay around 100.
Okay. Okay. So I have to live longer. So I have to prepare myself
Mm-hmm.
to be fit to live longer. I mean,
Mm-hmm.
not just longer, but laying on the bed.
Yes.
But standing, walking, running,
Yes.
maybe not running. But
I
anyway,
need you to be
okay.
healthy, okay,
Okay.
together with a longer age years, not longer year that you stay okay on earth, but stay on the bed,
Ah.
eat from the
Tube.
silicone and plastic tube,
Uh-huh.
and pee pee and poo poo
Uh-huh.
on the bed
With the
with
diapers.
the diapers.
Okay. If those who are facing something like that, we I mean we as we are still healthy, so we have to try our best. So how often do we have to do the checkup then, Kun Yui?
Mhm.
Uh-huh.
For healthy people or
Uh-huh.
didn't have any health problem,
Uh-huh.
if you compare with your previous checkup,
Mhm.
1 year is enough.
Once a year.
Once a year,
Mm. Okay.
we call annual checkup.
Okay. So every year. So if I never done that before, so should I call you and should I book in advance? And how is the process that if I okay, now I will do that as doctor suggests. I think I feel healthy, but I better do my first checkup. I better do my annual checkup. How should I start?
Actually, we have many channel.
Uh-huh.
Now we have a website that you
Mhm.
can search our program in
Mhm.
website, or you can call if you don't want to search the information by yourself. You can call the nurse at
Mm.
wellness center, and uh, they will give you the advice to
Okay.
choose the package and preparation.
Ah, I know. World Wide Web PhuketHospital.com. That is
Right.
how to get to us. And you also can note Attention Wellness Center, or you can call 1719. That is our hotline number. I mean, if you are here on Phuket Island or in Phang Nga province or in Krabi province, if you call 1719, you get us, Bangkok Hospital Phuket. But if you call us in Phetchaburi or Rayong, you may get another one.
Yeah.
1719 in this area
In
is
this
hot.
area.
Bangkok Hospital Phuket, and ask them to connect you to wellness center. Yeah, they're working from actually 8, like office hour, 8 o'clock until 4 o'clock in the afternoon. Okay, so then you can consult with a nurse, either Kun Yui herself or her team. Yeah, which can give you, for example, if you concerned in special part of your body, you feel more focused or concerned on that part, for example, then you can ask the nurse. I mean, better than talk to yourself or talk to your neighbor, talk to the nurse. Okay, so at once when I call you and
Yeah.
then I come to the checkup, So how is the activity going to happen in your station? Where is the station?
Our station wellness center is fourth floor
Mm.
in the main building.
Mhm.
When you entrance and it is first building you see and go up to the fourth floor and you we will registration
Mm.
registration and then talk with the nurse. We
Mm.
will start to ask you some questionnaires about your health
Mm.
or and assess your physical like a check blood pressure and
Mm.
uh, or data will see what's your risky
Mm.
and what's package or the test that is met with you.
Don't feel it is boring. Even you are not the first time there, or even your last week already came to the hospital, but they will check your blood pressure again. They will ask you questions again, and it's happened many times that
Right.
when I assist the foreigner who come into the hospital, they keep saying why we have to ask their name all the time. Why don't you talk to each other and say I am Mr. Smith and I'm here already 2 hours? That is to confirm that you are the one. This is to avoid the error which may happen. Okay, and that is the standard of giving the right treatment or procedure to the right person.
Right.
Not only your name, we also ask your date of birth. You have to say it
Every
again and
time.
again, again and again.
But
Okay.
okay, we never ask about your timeline. Okay, don't worry.
I experienced some cases that if they want to come and they want to know exactly how long I have to spend the time there in your station at the wellness center, can you please share with us? Because uh, some young people they're still working, they still
Yeah.
have to go to the place, the workplace, and attend the meeting, for example. Can you tell me, and then we can share with the
You
audience.
can give
Yeah.
us a few
It
hours.
depends. It depends on the
Mhm.
package or
Mm-hmm.
the list of the tests.
Mm.
If you check in like small program, just only take blood, chest X-ray, and check the urine, ECGs, take only 1.5 hours. Then
Mm.
you can go out to work, and
Mm.
then during we waiting for the result, you can come back, like
Ah.
today in the afternoon or another day.
So I think it's also good if you can bear with us the information. For example, uh, some appointment may say, I can be here at 8 o'clock, but I have to leave the hospital by 9 o'clock. We will try to manage, and you can come back again at 1 o'clock afternoon after lunch, or you have to go very far away. You cannot come back in the same day. Let us know, and we design the way to give you the best service.
Right.
Yeah.
Yes. We
I'm sure.
customize.
Yeah,
We
yeah.
customize that the program that
Yes.
when you okay, we customize your checkup program. Okay,
Mhm.
the package, the total package,
Mhm.
and then that yes, okay, she will ask that the time that most convenient. Okay,
Mhm.
for you. You have a few hours in this morning, and then okay, you need to leave our hospital for work, and then you can come back in the late afternoon or tomorrow morning. Hey, you can provide and arrange. You can be easy.
But and also if you have the big program,
Yes.
it's
Yes.
not possible.
Very
Uh,
complicated
Yeah,
program.
maybe if you have a little time, you can take the test 3 days, no problem.
Mm.
If you can come many days.
Okay.
Mm.
I think that's why we need to talk and share exactly what you need and what we suggest you to do. Um, I think what because for example, the one who come like first time checkup after 30, 35 years old, they may need the small package, as you said, the
Right.
basic one. I think, but it's very important to do the first checkup because you will then have the base data. And
Mhm.
after that, after 2 or 3 years,
Mhm.
if the number is changed with something abnormal, yeah, the number shouldn't be like that. The blood result shouldn't be like that, and then we can focus and concern and like care more on that point, for example. But for someone like me, as I said, working until now, 50 years old, and also even mentioned about 100 kilogram plus,
Mhm.
and everyday life is like working 12 hours at least per day.
Okay. After I look at your body, okay, and your talk, I think that
I think I have many friends on the island, not just me.
you concern, okay, almost less thing, okay. But for me, okay, I'm the physician, okay.
Okay.
I concern more. I concern more, okay.
Okay.
We start at the first, okay, from Kun Yui, okay. We'll tell you vital sign and suggestion and set up the package.
Yeah.
The package, okay. The traditional checkup, we start with four major organs. And one fluid. We start with your heart, your lung, your liver, and your kidney.
This is for those who are like 50.
Yes, and your blood.
Okay,
And
blood,
your blood,
heart, lung,
liver, kidney.
liver, and kidney.
Yes.
Yeah.
The function is still okay or not.
Mm.
And your blood test show us that you came in your concentration of the red blood cell in your circulation. Okay. But nowadays, we go on, okay, so far from the traditional. We set up many machines in the imaging unit, CT scan or MRI. We can do both of your brain and your heart. And then that now we will go deeper in your cell, deeper to we call that molecular checkup machine. Molecular checkup machine.
We know this word molecule, but this time you say molecular.
Molecular checkup.
Wow.
And genetic checkup.
And genetic too.
Yes. Inherit from your dad and your mom. From genetic checkup and molecular checkup, we can tell you that the disease you will get in the future.
May get.
Yes.
Or exactly get.
Yes.
It
And
depends.
the disease you will never get it.
Oh.
What kind or what type of the food or meal that you should take? What kind of the sport and type of the sports that you should join?
Oh.
The hidden allergic reaction that may be hide in your body.
Yeah.
And some vitamin or mineral trace in your body that deficiency or overconsume. Okay,
It's
beyond diabetes, sugar level, beyond
It's like you're
lipid
going to be
level.
my fortune teller
Oh,
to
yes.
tell me how to live my life and but happily. I mean happily and healthy, and I will stay until 100 years old.
Yes,
As you
yes.
said. Wow.
Like a fortune teller, but we tell it from your genetic. That okay, you receive it from your ancestors. That sends okay to you.
So in the past time, like if I heard, for example, mommy got hypertension, papi got hypertension,
Heart attack,
yeah.
cancer.
Oh, that's why they keep asking when we talk to the nurse.
Right.
Yes. Yes.
Sometimes I have to call my mom and ask whether one of member in our family or our relative got that kind of disease or not, because we just know the name of auntie, uncle, or name of grandpa, grandma, but we don't know how they pass away, for example. That's why. But not just know the disease, but now we do the molecule check
Molecular checkup.
and also the what else the genetic one. Then I think that is also the reason why we used to eat together. I saw that she eat more than me. But you still can be in the good figures.
Both of you may have that the same lipid level.
Yes.
Maybe I
Maybe
have more
or
than
you
you.
I
is
have
more
no
than
problem
you.
Because
Yes,
my family history has high cholesterol.
cholesterol.
I don't have that problem. I don't have fat in the blood because it's outside.
Yes.
I want to stay outside.
Okay.
I have it inside.
Oh, I see. Okay, that is also one of the answer. Even I don't do the checkup yet, but I think then I will focus more in detail as you mentioned, and then I can decide which food I should avoid, which food I should consume,
Yes.
and what kind of activity will help me to stay healthy and live longer life and quality life. It's not the main idea to live longer if it's not a quality
healthy.
one. Okay. Yeah.
And let that give the time to Yui to give the example of the package we have this year.
Because
Right.
right now
Right.
I mean, at our checkup center, for those who keep coming back,
Mhm.
maybe someday they come in May and May, June. That is the period that we also have
Mhm.
promotion.
Yeah.
Mhm.
It's the birth month of the
Our
hospital. Yes,
birthday.
there are many people who come in that period of time. But for those who just come on Phuket Island and want to start doing something like checkup, we have the promotion which lasts from today until the end of February. Special price, special offer. But I think the nurse can explain better. If we go in detail, for example, the main checklist, the main
Yeah.
package. We're gonna show on the screen. This checkup program
Check it
we call
out.
Alright Checkup, and the price, this promotion will last until
Mhm.
end of February of this year.
Right.
Mm-hmm.
This
Okay.
package will have the main two parts.
Mm-hmm.
The first part will be include, like Dr. Chachai said, will include
Mm.
blood test,
Mm.
urine exam, chest X-ray, and ECG. The blood test, we have
Mm-hmm.
to check about blood, like a complete blood count,
Mm.
that we can see white blood cell, red blood cell, platelet to screen your anemia. I mean red blood cell, and also the chemistry in your blood, like sugar,
Mm.
cholesterol, triglyceride, or any liver function, and screen kidney function.
Mm.
And the part two is will be options
Mm.
that you that we ask you about your risk, and we can decide what option you need to do. Like you had already high cholesterol for long term, you might check your liver by ultrasound to see how about fatty liver.
Mm.
Or if you had already kidney stone, you also want to check ultrasound. Or you are women more than 40 years, maybe you need to check the mammogram or thin prep
Mm.
screening cancer in cervix.
Mm.
Or man guy more than 40 years, they
Or,
need to check
or
the PSA. Screening
over
prostate cancer in
40
blood.
years old for the female should do the mammogram.
Mammogram.
Mhm.
And
Okay. Let
Yes.
me ask you. Even we have or we don't have boyfriend, no one touch. Not
Doesn't matter.
never,
doesn't matter.
Doesn't
right?
matter. Doesn't matter.
I don't know
Doesn't
whether
matter.
if we use it
The
more often,
risk
do we have
is,
to focus on?
yeah, the risk will be less than family woman.
Ah.
But and also
I put her
gynecologists
in difficult situation.
and also gynecologists will not make this test.
Okay.
Just only we can wait until she has the problem about gynecology, then
Hmm.
doctor will let them
I
check.
think even the teenager, the girls, I mean,
Yeah.
who has problem with her menstruation, they should
Menstruation.
come for check.
Gynecology.
Yes,
Yeah.
yes. To as Doctor mentioned, to avoid from difficulty and the earlier detect, it means the better outcome of the treatment. Okay.
Fortunately,
option.
okay, I'm a
Mhm.
man.
Yeah.
I'm a man, so
Uh-huh.
that I have the less organ, okay, to check out.
Mm.
Yes.
And also,
So lucky.
if you think the part two is not still enough for
Mhm.
your risk, we will advise you and give you the special price for top up.
Mm.
Like someone has their a little high of sugar, we will suggest to check hemoglobin A1C. We will
Mm.
see the controlling of the sugar in
Mm.
backward 3 months, how you can control your sugar.
Uh-huh.
And
deep.
also female need to check mammogram and also thin prep. You
Mhm.
can choose mammogram and add top up for thin prep.
For mammogram, so many people they're scared of the process.
It's not so pain because now it's digital mammogram.
Mhm.
Digital mammogram, less pain.
Less pain.
But
Less
I didn't
pain.
say that's not pain. It's
And-
less pain.
And more clear imaging.
That is more important because the updated or latest machine, the doctor can see things better
Mm.
And
Right.
Yes.
if it is clear, then we can detect even something small
Right.
and
And
smaller.
also, doctor will combine with the ultrasound
Ah.
risk for you to
Mhm.
combine with your physician, the radiologist will see the picture and also the ultrasound and compare.
Almost
Yeah,
of
but
that,
oxygen,
almost
oxygen.
of the our customer will concern first, okay, how big of the package, okay, they need, and they will ask about it, เจ็บไหม hurt or not.
It's pain. Yes, pain a little bit. Yeah.
They concern less, okay, about the time, but they concern that hurt or not, hurt or not.
But
May I hurt?
Yeah.
Every test can be tolerance, can be you can hold
Mm, mm.
not too much.
I have to say, for example,
Mhm.
to do the mammogram, or someone feels shy to do the check, the female check, for example. But if you get sick, it's more pain. And
Mhm.
and for example, some part of the body, if it's sick, then our doctor will visit more more time on that location, on that station. I mean, to do the checkup once a year, uh-huh, to stay healthy, as doctor said, it's better than to no, I feel shine, oh, I feel pain, I don't want to do it.
Mhm.
But if you need to see the doctor and you get a sickness, then you will have pain with you and you have to live with it. And you also have to, even you feel shine, doctor will ask to see it again and again.
Mhm.
Yeah. It's better to do once a year checkup.
Yes.
I confirm. I confirm. But I mean, if I have like someone in the family who pass away with a heart, do I have to go check up in your station or should I go to the heart center? How is it?
So you can start with
Uh-huh.
Yuri.
If you think you are people, young people, and past history, have to see
Family history.
history.
Uh-huh.
If they have passed away or have heart attack in the young
Young age.
in the young age, you also need to check with the heart center as well.
Okay. Well, don't worry. You don't have to make your own decision. Once when you come to the wellness center and you have done the checkup, and our doctor, our physician, after consult with the
Yes.
physician,
Yes.
then our doctor will give more information and suggestion, and also send out to the right
Consult.
person, right?
Yes.
Yeah.
So how is the process if we get the result, we get the laboratory done and also the imaging done, then we have chance to talk to the doctor, right?
Mhm.
Yeah.
Okay.
Doctor will
Report.
explain you about your result,
Mm-hmm.
about your abnormal result,
Mm.
what you should do further.
Mm.
Maybe you need only follow up, or need to consult the specialist
Mm.
to close observe,
Mm.
or observe or follow up 3 months or 6 months.
Mm.
Uh,
Okay. And some tests I heard that we don't have to do every year, but maybe every 3 years or every 5 years.
Possible.
Uh-huh. But what I see is in Bangkok Hospital Bukit, we have so many departments. And I think if we detect something, we don't have to send you out. I mean,
Yeah,
yes,
we
of
have
course.
specialists, specialty.
We provide that
Uh-huh.
almost of that the specialty of medicine,
Mm-hmm.
okay, to take care of you. If you have some, not the problem, okay, right now, okay, just
Oh,
the
then.
abnormal we detect, okay, we can consult, okay, and send you, okay, to the right department, okay, to collect, not the treatment yet, okay,
Mm.
to collect your problem first.
Mm.
Consult with the specialist. Will ask you maybe some abnormal value show in the report.
Mm.
You would do nothing.
Mm.
Just observe. Just take care yourself. Lifestyle
some
modification.
give some
yeah.
suggestion.
You
Uh-huh.
eat less, okay, and
Okay.
exercise more.
Eat less,
Okay,
drink less,
don't
sleep.
drink less. Okay, you don't smoke, really.
No,
Okay,
I don't smoke.
okay, and
I don't have time. My fingers are busy.
but okay, some abnormal value we need to do the further
Uh-huh.
investigation, or
Uh-huh.
maybe that some prescription of that medication to collect it, and then make follow up. That's it.
Mm.
That's it.
Mm.
If there is a serious problem, don't worry. Okay,
Mm.
our specialist, okay, can provide the serious treatment, deeper, or we call it the aggressive treatment or operation. Yes,
Mhm.
we provide.
Yeah, I like it. I used to visit the wellness center and help the German patients who I work as a translator.
Mhm.
And that person, she said she liked to enjoy her life. So once when doctors say to avoid from everything, he said, please allow me to eat a little bit of sugar and chocolate and ice cream. Then I can live my life happily. I don't want to live 100 years without ice cream and chocolate. Then she bargained
Mhm.
with the specialist later on to take
Mhm.
one tablet a day, but like meet at a halfway.
Yeah.
She still can enjoy her ice cream, but not much. Ice cream and chocolate and a tablet a day. So that's
Okay.
the reason
In
she
some,
want to
in,
continue living.
yes, in some case, okay,
Uh-huh.
if you suggest them, okay, to stop, or
Oh.
refrain for many things, okay,
More
they say,
stress.
I die now. Okay.
It's better to die now without
Die now.
everything.
Or die next. Okay.
Okay. Yeah, that I think maybe that's kind of consultation is important, and I think we should not compare our quality of health and quality of life with someone next door, because sometimes we consult the neighbor, the auntie, the uncle who has maybe only one keyword,
Mhm.
hypertension or diabetic, but I think everyone has totally different
Yes.
genetics,
Yeah.
as you mentioned, or inside there may more
Genetic
detail,
different. Okay.
genetic different. So
Mhm.
you have your own file and you fix your own problem, but with the expert team. Okay.
Yeah.
Uh-huh. I think if you have the question, you also can send it to us. But Kun Yui, before we leave today, can you please suggest that before I come to the checkup, how should I prepare myself?
Oh,
Uh-huh.
about preparation for checkup, you must refrain from food and drink 10 to 12 hours prior
Mhm.
checkup because we will check like sugar, cholesterol, or
Mhm.
someone need to do the ultrasound.
Mm.
And but someone take
May I
if
drink?
you take
May I
uh,
drink?
if you
Drink.
really
Thirsty.
thirsty, you can sip little
Beer,
water,
a little beer,
only water,
a little bit.
please, doctor. And
So if there is a glass of water, how
Glass
much can
of
I?
water.
just
How much should I
just
allow?
just sip water,
Sip
half
water.
half,
Or
not
less than
not
half of the
less than
glass?
half of.
Okay. Okay.
And and also medication. If you
Ah.
take medication like a blood pressure
Mm.
tablet, you can take with only 30 cc of water,
Okay.
just a small amount.
Okay.
And if you're pregnant, you have to tell the nurse when you arrive because you might get the radiation approach.
Mhm.
So we have to
If you are
prevent.
our regular customer, we know. But
Yeah.
anyway, it will be shown in the system. But if you're new with us, give us as much as possible information that we will stay and concern, and we will do the best for as customized, yeah, per person. So we may not do the same for everyone, but we do the best for each one.
Right.
Okay.
You even teasing her, okay, if you ask her why come to our department that, "Hey, you are pregnant or not?"
I'm
And
not
if
killing someone.
and if possible, you should stop smoking
Uh-huh.
24
Mhm.
hours. Take rest more than 8 hours
Uh-huh.
at the night before, and should stop alcohol drinking for 24 to 48 hours. This is the best
Okay.
preparation.
We don't say you have to stop, but if you can stop, it's good.
Yeah, it's good.
If we
I
show
mean,
in the
I mean,
result,
drinking
show in the
and
result,
yeah,
if you drink
smoking.
alcohol, something, yes,
Ah,
we show that your liver function, you rise up.
I see.
Yeah, because your liver
I heard
will.
that if someone maybe a week before coming to check up, they manage their food, their nutrition style, the best and clean. But
Mhm.
can you also detect that the last 2 months, eating
Oh,
and drinking like
yes,
crazy?
Sure.
it's
Yeah.
somewhere.
They
It's
can
somewhere.
detect it in
Yeah.
the blood,
That,
right?
because that you're regular.
Ah, yeah. Uh-huh.
It's
So
your
you
regular.
cannot
You
lie
cannot
over that.
lie on the result.
So you
Alright.
cannot just avoid หมูกระทะ or like hot pot program just a week before coming for checkup. Yeah, kind of.
Yeah.
Okay. So I have seen a lot of package, the checklist, and also the top up that we offer them very special price. And for those who would like to come for check, please just contact us. As I mentioned before, World Wide Web PhuketHospital.com, or contact 1719, or you can scan um, our line, the expat line, that you can communicate with our team. So we have the team which will ready to answer the question you may have. And please, it's until the end of February. And we wish everyone stay healthy and living quality of life. And right now, everywhere on Phuket Island are so beautiful. So enjoy your life and enjoy living on Phuket Island. And we wish to see you for annual checkup, but not as a patient. Okay. Thank you
Okay.
for today. Thank you, Dr.
ครับ
Chatchai.
Yeah.
Thank you, Kun Yui, our nurse. And I will see you next time. Thank you and goodbye.